Good afternoon, everyone. Thank you for joining today. We have our Living with Diabetes webinar with a few people here from Wegmans who have coordinated with us. We have Erin, Liz, and Emily. The meeting is recorded, so you can go back and follow up if you have any questions or weren't sure on something. They are taking questions throughout, so please feel free to unmute yourself or put them in the chat and we will answer. And we'll let you take it away, Erin.
Thanks so much, Jess. So as Jess mentioned, we are here to do a little presentation on living with diabetes, whether you are a patient that's living with diabetes, because those guidelines and those technologies are constantly changing, or if you care for someone that is living with diabetes. An overview for both of that. My name is Erin Rollins. I am a pharmacist by trade, but also the Clinical and Wellness Services Coordinator here at Wegmans Pharmacy. I'm joined by my intern and graduate student, Liz, who will be helping me with some of the presentation today. We're also joined by Emily, who is also a pharmacist and is happy to answer any questions that you guys may have. So absolutely feel free to stop us throughout the presentation or drop questions in the chat at any time, and we'll be happy to answer them for you. So as far as our agenda for today, we're going to start with just an overview on what is diabetes in case you don't know. Some things that you can do to prevent diabetes, especially if you're in that pre-diabetes stage. Blood sugar testing introduction, which has a lot of new cool advances in technology there. An introduction to the common medications that we use to treat diabetes as well as pre-diabetes. Signs and symptoms of low and high blood sugar if you're caring for someone with diabetes. And then some slides that will really focus on some takeaways from today. So with that, I'll give it away to Liz to start to introduce us to diabetes here.
Hello, so I'm Liz. I'm one of the interns as Erin had mentioned. So I want to go over just introducing you to diabetes. So we have that it is, of course, as you may already know, a chronic metabolic disorder that's characterized by just having high blood glucose levels or blood sugar levels. This can either be classified as being type 1 or type 2. Type 1, as you may have heard, that's where you have the impaired insulin secretion versus type 2, where it's just an insulin resistance. So type 1 is generally, as we'll go over, in younger individuals, and it's just that you don't have that insulin secretion to react to when you're eating simple sugars and carbs. Versus type 2 is where you've had that ability at one point in time, but now the cells in your body isn't really reacting to that insulin that you are producing. Insulin itself is a hormone that is essential in regulating blood sugar. So you have your type 1 diabetics, as I was mentioning, is usually diagnosed in younger individuals. The peak times where they find this diagnosis is between ages 4 to 6 and as well as 10 to 14, kind of where you see a little bit of those like hormonal shifts. It's also considered an autoimmune disease, which differs from type 2 diabetes. This is just due to the body's own self-destruction of those cells that secrete the insulin. So they just don't have any insulin to produce anyways because the body's destructing that. Type 1 diabetes is considered non-preventable. It's just kind of genetic link and stuff like that. But type 2 diabetes occurs diagnosis usually later in life, so ages 45 to 64. But we have been seeing increasing rates in children, and that's kind of been a big area where we want to catch it earlier in life opposed to later in life. This is due to a combination of that insulin resistance I talked about, as well as just destruction of those cells that produce insulin too, which happens usually later down. This can eventually lead to that relative insulin deficiency, so you just don't have insulin that can do anything. Type 2 diabetes can, however, be preventable in most cases.
I will jump in here too to say, if you're looking at this slide and you're looking at that type 1 diabetes category and you're saying to yourself, well, I'm way past 14 years old, so I don't have to worry about that here. We are seeing lately trends in an increase in later onset diagnosis of type 1 diabetes. So absolutely, as Liz is going through the signs and symptoms of diabetes, it's absolutely so important that you're getting screened because there is that chance that you can be diagnosed with type 1 diabetes later in life, and we are seeing that trend start to happen.
So some risk factors, and this speaks especially to type 2 diabetes, is just general, obesity, having a more sedentary lifestyle. Like I mentioned, genetics and a family history can play into this. Having a diet that, of course, is more like fast food or sugar led, excessive sugar intake from your sodas or sweets like that. Having other conditions like high blood pressure, hypertension can lead to this a little bit. High cholesterol. So when you have your LDL values and those such things come up a little more elevated due to like the fats and like the wrong kind of fats that you're consuming. And then smoking, of course, can always play a role into this as well. So we have, as we were kind of mentioning, we get into pre-diabetes, which is basically like a stepping stone before diabetes diagnosis. And this is where you start to get those elevated blood glucose readings. You get your fasting blood sugar. So when you go to the doctor and they tell you to fast for 8 hours or so, that value starts to become increased. They also might have you drink a sugary drink that no one can ever tolerate. But that, especially that they do also during diabetes, test for gestational diabetes, if that value comes back elevated, so your body isn't producing the insulin that it needs to kind of overcome that overload of sugar that you consume in that time. If that value is increased, they might start to be wary. And then they also look at the A1C. So that's the average of basically all your blood sugar levels. So that's the amount of sugar that's on your blood cells in a sense. And they take that every about like 3 months and they look at that average over the past 3 months. So goal is to be under 5.7% for A1C. That fasting blood glucose is to be at a goal of between 70 to 99 milligrams per deciliter. And then from that glucose tolerance test, that sugary drink, the goal is to be under 140 milligrams per deciliter. As you can see on the picture there, there's kind of like the normal values there. So green light means go. And then our orange light there is for the pre-diabetes stage. So like those in-between values that don't necessarily lead to an exact diabetes diagnosis, but is where they start to be concerned, where your providers might start giving you some medications to help with that, or at least definitely instructing you to work towards changes to like diet and exercise and stuff like that at that point.
It's really important to note too that on this traffic light, it's not one directional. So once you get to a level, let's say you've gotten all the way to red and you have a glucose level that's 200 or higher, you can reverse and go back down all the way to green. So by taking the right steps, you can go from a range that's diabetes to pre-diabetes back to normal. You can progress back and forth on this, which is an important note that once you've gotten to one level, it doesn't mean that you're too far and can't reverse and go back. The other nice thing too is that especially around here in our health systems, they're so good about putting in your chart if you've had an A1C, if you're at goal, if you're a little bit over goal, you'll be able to see that immediately flag, and whether you're using like a My Chart or a My Care. So nothing that you have to have memorized here, which is really nice.
I want to make one point, if I could. For those of you who might have seen those CGMs that you put on your arm and you measure your glucose or your blood sugar that way, because it's over the counter now, it's available. Those aren't as accurate, and you can't necessarily draw the same conclusions when you look at your numbers throughout the day, because very commonly they might be 20 to 30 points off. So it's very important to understand that you have to get an actual blood finger prick test to really see what your sugar levels are. You don't want to just rely on those CGMs.
That's a great point, John. Thank you. So really why we're even talking about this here, we're hearing diabetes be thrown around, the word pre-diabetes thrown around, but what really is the threat here? So we do have a significant portion of our population that is in that pre-diabetes stage, 98 million Americans, and that's more than 1 in 3 Americans that have pre-diabetes. What that equates to is about also 8 in 10 adults with pre-diabetes don't even know that they have it. We do also live in a world where primary care is kind of lacking as well. So we have a lot of adults that are walking around without being screened and knowing that they're in that very important pre-diabetes stage where they can get back down to normal before it does progress to type 2 diabetes. So with pre-diabetes, you're increasing your risk of getting all the way to type 2 diabetes, which we'll get into the difficulties of managing once you get all the way to type 2 diabetes. and also increasing your risk of heart disease and stroke. Liz is going to get into what we can do to kind of reduce our risk there, but a lot of that comes down to healthy eating and just being a little bit more active, doing the things you enjoy. And that can be as simple as just taking a walk every day. But Liz will get a little bit more into that later. It's really important too that we talk about the effect that diabetes has on our heart health. It can double your risk for heart attack and stroke. It can increase your risk for heart failure and heart disease. It can damage your blood vessels by causing an increase in buildup of fatty material, which then causes the blood vessels to narrow and restrict blood flow. So it's really important that we talk about the sort of connection between diabetes, uncontrolled diabetes, and heart health. And really how that happens is that how it can speed up heart disease is through plaque buildup in the artery walls. What that causes it to do is narrow your arteries, and that can happen faster in people with uncontrolled diabetes. If that plaque then cracks, that's where we see blood clots that can start to form or block the arteries, and that's how you increase your risk of having a heart attack or stroke when those blood sugars are going unmanaged. So then you might be asking, well, what even causes prediabetes? It's really a breakdown of insulin. What insulin is a hormone that acts like a key in a way to let blood sugars into your cells, which your cells then use for energy. But in prediabetes, they don't respond normally to insulin. So your pancreas, what it will do is make more insulin to try and get the cells to respond because they're not responding the way that they should be. And then eventually what'll happen is your body can't keep up, and that will cause your blood sugars to rise and lead to some of those effects that we just talked about.
So some signs and symptoms of prediabetes, just to, keep in the back of your mind, is of course being overweight. We see this also in older individuals, so being 45 and older, having any, like familial history of type diabetes. So if it's a parent, a brother, sister, some more immediate relation that has had type 2 diabetes, that might also be a sign, that might be an indicator of like, hey, maybe what I'm feeling might be kind of what they're going through. Also, those who have that sedentary lifestyle, so if you're physically active less than 3 days per week, that might contribute to this. Those who have had a history of having gestational diabetes during their pregnancy might be at an increased risk as well. And then those, which is such an odd one, but giving birth to a baby who weighed more than 9 pounds is also an indicator. And then individuals who have PCOS are also included.
Also here, important to note that as we go throughout this presentation and sort of talk about risk factors, prevention, we're mostly talking about type 2 diabetes here. For type 1 diabetes, there is still a ton of research that goes into exactly what causes it. Is it some sort of genetic link? Are you more at risk? If you do have a sibling, parent, brother with type 1 diabetes, is there some sort of viral infection risk? Still a lot of research and unknown that goes into this. So while you're looking through these checklists of a lot of the symptoms are going to be pretty similar, but as far as like prevention and checklists, we're mostly talking about type 2 diabetes here.
So in case you are at that pre-diabetic stage, here are some ways that they usually, your doctor may even tell you to prevent progression to a full diabetes diagnosis. So that, of course, naturally includes weight loss. So losing 7% of your body weight can reduce the progression to diabetes by about 60%. Aiming for that physical activity and increasing that. So the goal for like almost anything is for the 30 minutes a day, 5 days a week. So if that's walking, is that's going to a class that you like, if it's, walking the mall every evening, some of our malls around here, definitely you could get that kind of activity in. But items like that help to improve the muscle and insulin sensitivity. So it's basically building that connection with the insulin and then to your like muscles as well in order to help lower the blood sugar and get that value down. So you'll be in like that orange range, but you want to bring it back down to green. There, of course, as we'll get into too, is nutrition changes. So just increasing natural sugars found in fruits and vegetables, in moderation can help to regulate blood glucose levels and improve insulin sensitivity. So you're not losing that connection that insulin has on your blood sugar. And then in general, just food that makes you feel good. So finding ways that, I know we've all been there where we've gone to a McDonald's or Taco Bell and had like the greasiest thing on the menu and then not felt so good the next day, but we want to aim for food that will make you feel good so you can get that exercise in, so you can be active, you can, lose the weight in a way that's you can keep and continue with your lifestyle. So Wegmans does have, of course, some really good resources. So this was from me going online just to wegmans.com, and I think I searched in diabetes and went to like meals and recipes. So you can pull that up. They're really good now about, this was under they have one specific header just for diabetes meals, diabetic meals, but then they also have some for if you have gluten sensitivities or a vegan diet base. So you can find almost anything. I thought a good place to start was breakfast, because breakfast inherently is full of those simple sugars and carbs. And so finding ways to make that healthier. So there's a gorgeous picture of avocado toast on there that I thought would be a great, just like a example of a better breakfast for individuals who are even in that pre-diabetes or diabetes stage. So getting in the healthy fats from the avocado, getting in the moderate protein from your eggs on there, and then like a good whole grain that isn't too much in the simple carb category. As well as you can see there's another recipe for eggs with spinach and carrots. So getting those good non-starchy vegetables in there as well.
So like Liz said, there's an entire section on Wegmans.com. If you go to nutrition, on just living with diabetes, all kinds of recipes geared towards your lifestyle. If you're someone who's super active on the go, you don't have a ton of time to make dinner, there's recipes that will work you through that. These are all built by our nutritionists here at Wegmans. So we do have a team of corporate nutritionists who help manage these web pages along with our pharmacy team. So they are just really very knowledgeable people and great resources that we have available on our website for everybody.
So going into what constitutes a healthy meal, as you can see in that diagram there, anyone who has probably been to any kind of webinar on health in the past like couple of years has heard a little bit of that plate model. So you can see that it has half the plate being those non-starchy vegetables. So that's like those that are pictured in that image, the leafy greens, the mushrooms, which I was, pleasantly surprised that was in there, carrots, broccoli, cauliflower, those type of things should take up about half your plate when you make your meal planning. They also, that top quarter should be about your protein food. So if it's like chicken breast, if it's turkey, like lean meats, avoiding, of course, usually red meat still. And then having another quarter designated to those like the grains or the starchy veggies. So your brown rice, your potatoes, your corn, those kind of items are what you want, just a quarter serving of. And then having that little plate dedicated to like a fruit or milk or yogurt, something that has some of those like better natural sugars for you. But everything you want is about portion control. I know I've heard about it since I was young from grandparents and family members like that. You don't want to have the whole bag of the chocolates, but you want to have like a couple, like a serving size. So just like knowing where your portions are. That's to say you don't have to not have that donut, but have that donut like once a week opposed to every day. So just limiting starchy vegetables, whole grains, and sugary fruits. So that includes like watermelon, right? That's like just mostly sugar, water. So within that, limiting sugar sweetened beverages, so your Coke, your sodas, anything like that you would think is like a really sugary drink, Mountain Dew. Limiting those and going for like a different form of caffeine potentially. I know myself, I've looked back at, the Starbucks drinks and things like that. And so getting, even those can be really sweetened and sugary. And so limiting the amount of like pumps of syrup you put in there and what have you can also make a big difference. And then ultimately, you just want to choose something that you can maintain, something that fits with your lifestyle, something that's not going to bog you down every day thinking, oh gosh, I have to wake up and eat that same thing every day. But having something you can enjoy as like a snack, or you enjoy preparing with your family, or something that has vegetables in it that you can have family members help cut up or something around the dinner table, something that can get you all kind of involved in it and make that change to your lifestyle. So then we're going to go into a little bit of the blood sugar testing. So a lot of it is usually done through lab work, and you get your levels, your blood drawn, and then your doctor looks at those values, and that's when they usually bring it up in your primary appointment about where you're at in regards to diabetes, prediabetes, or within the healthy range. But then another big portion of this is just at home testing, right? So you can know in the moment where your levels are. These get used in insulin, so those type 1 diabetics are going to have a meter at home. They're going to have insulin products, that's just how they have to survive, since they don't have insulin in their body that they're naturally making. So they have to provide that insulin injection. But in type 2 diabetes, this comes on a little bit later on. If the primary methods aren't working for you, then they might start an insulin. And eventually sometimes they use it with meals. So they'll have you test your blood sugar and then kind of make adjustments to how much insulin you need. And that's what's considered a sliding scale that you'll see. Doctors will write prescriptions of like, oh, if your blood glucose is within this range, use 3 units, or within this range, use like 4 units. And that just helps to determine a dose. It also just gives you insight into your most current blood sugar level. So it's something that, heck, like if you're just curious, you can get, unlike with the CGMs that John had mentioned, you can have these at home and they give you more of like that accurate current dosing. Just that's in your blood, right? Like it's a little prick and then you see the value, and allows for the self-management of diabetes. So you can kind of take a look. CGMs are wonderful in the fact that they provide this continuous picture of your diabetes. So it helps really with those like overnight when you're not going to get up and test your blood sugar, you can get that value like overnight. And it's nice that they also have alarms that go off if your blood sugar ever gets too low, and you can have family members hooked up to it so they know if your blood sugar is getting too low. So there's just so many advancements in that. Both of these are usually always covered by insurance. It just might depend on which brand or which manufacturer they're covering, but usually there's an insurance coverage to this, especially with the traditional blood glucose meters can add up in all the parts and pieces you have to get. So this like testing strips and the lancets to prick your finger, it can add up. So having something that's covered by your insurance is nice, but as John had mentioned, there are some of the CGMs, especially that are over the counter now, and those are costly, of course, but there's something you can also get there.
Yeah, I will say that, giving this presentation, if we were to give this 2 years ago, it looks totally different than it does now. We're really starting to see those old school meters with lancets and test strips move out of favor. And almost all of our patients, the gold standard are these CGMs, just because they do provide you with so much data. Typically, when you have a patient pricking their finger multiple times a day, that can become a lot versus slapping on a CGM to somewhere on their body, and they're constantly getting data. They'll keep those meters really for backup in case they have a really high blood sugar or really low blood sugar. If a patient starts to feel really off, they'll go and just prick their finger because it is a more real-time blood sugar level. But we're seeing these become really, really popular in our patients without diabetes as well, especially in nutrition programs. Like Liz said, like some of the fruits, vegetables that you don't really even think could be raising your blood sugar a lot. People are finding out so much information by putting on these CGMs that, they think that their breakfast is this nice, healthy, low sugar diet. And then they slap on one of these CGMs and find out that it's spiking their blood sugar uncontrollably, which can really take a long time for your body to regulate and get you feeling good again. So we do see these very popular and very common in patients without diabetes as well, just to gain some more information about what they're eating and how it's affecting their body.
So kind of going off what Erin had said, so the traditional blood glucose monitor does require the most pokes, as I've heard commonly from a lot of people, and especially like sometimes older individuals who can more reliably use this, but like getting them on board to start using it is always problematic. And this is also one that most people will start off if they are in the pre-diabetes stage, because for a lot of the CGM devices for coverage, you do have to have that formal diagnosis of type 2 diabetes for your insurance to cover them. And if not, they're really costly. So this is like a good old reliable to have at home. It allows for the quick testing and is usually used for backup. So as we'll find out with CGM devices, or maybe you've heard, they can fall off every now and then, or you can get a faulty one from the manufacturer. And so having a backup blood glucose monitor that you can use, just, make sure that everything's going fine. If you're starting to feel a little funny or things are starting to feel a little off, having something that you can use to test with is always a benefit. Versus the CGMs, they allow for that real-time monitoring. We'll look at the readout to see kind of what it looks like. They are prescription only, but with the caveat that there are over-the-counter ones that you can purchase. I don't know if I've actually seen them in stores quite yet, but you can get them from their online websites. So I know, of course, Dexcom has made an over-the-counter version called Stello. Lingo is another one out there. And then like the Freestyle products have made an over-the-counter available option, the Libra Rio. But as kind of John said, sometimes they might not be necessarily as accurate. They might not have the developed software system that Dexcom and Freestyle has made with their programs. You'll also see that a lot of the CGMs now can be integrated with the Omnipod, which is an insulin delivery device, and I'll get into that a little bit. But it really is just about having an app, and you can look at your output, kind of like those Oura rings or any of those other like health monitoring systems that they have out there, from smartwatches even. It's all about like integration. So as you can see, here's just a picture of some of the, I would say like maybe top two. For a while, Medicare would cover the One Touch products there on the left. And so that was basically what those meters would look like. They're pretty, I guess, analog in a sense. You essentially, that little monitor there, it turns on when you stick the strip in there, and it gets ready and it tells you like, here, apply the blood to the strip. And then you use those little lancets, those little like drumstick looking things in the corner left there. You use those with a device to essentially just help prick the finger so you can get that sample of blood, and then you apply it onto the test strip, and the monitor would tell you like, oh, it's at 105 or what have you. On the other side is the AccuCheck Guide Me, which I think some insurance companies have been switching to wanting as well, just based on their formularies and everything like that. And that one is one that is integrated with your phone, so you can get it on an app too to also get your readings. And then we have the CGMs. So the big two are Dexcom and Freestyle, of course. They get changed for Dexcom, it's about every 10 days, and then Freestyle, it can be 14 to 15 days, depending on the year and the model. Essentially, the application is all the same. So it's always great to go to their site and YouTube. They have YouTube videos on how to apply them if you are ever looking for help with that. But essentially, you just want to make sure the area you're going to apply it is nice and clean and washed in that first picture. And then it's kind of like a press in, like a stamp. You just kind of like stamp it into your arm there, and then make sure you seal the raises of that application too, just to make sure like a sticker that it's on there correctly. And then it can be tracked with your phone. So I do believe they all have manual readers too. If as someone who isn't really into smartphones or doesn't even have a smartphone, you can have a manual reader that works very similar. And like on the videos, you see them swiping up to the meter to kind of like check it, but you can check it, at your leisure. You get those reports too that we'll look at, and they're just on there. So then here is a picture of some of the output that happens. So basically green means good, right? So you can see it's a 24-hour window that it's looking at, and you can see there's like a little spike around like 9 o'clock, and that's probably when this person went to go eat breakfast, right? And then their blood sugar levels rose in relation to that. And then you expect to hopefully see it come down and like little peaks when the insulin would take into account, whether it's from the medications or from the injections or the body's natural insulin. You can also see overnight, like at midnight, there's a peak there too. And it's well within still like that green zone, but this can also is just something a phenomenon that usually happens at night, but it gives you just a look at it. And I know some practitioners will take this output and look at it, and they can, if they're really, close with their patient, they can be like, so that's when you had your waffle, or that's when you had your bacon that you really like, or something like that. They, develop that, and they can see it in this data. And then here's just another, like, this is usually the top of that report. And so essentially what they are looking at is that green bar to be large. Like you want that time in basically range within those levels that are acceptable to be the majority of it. For this person, it was like goal is to have that green piece be greater than 70%. So it gives you just like a good outlook of everything. It also goes into the average blood glucose too, so just like where you usually kind of lie. And then as well with the variability and a little bit into kind of the A1C point, like it tells you that percentage, which is also really cool to have. So our first line treatments, metformin has been one of the workhorses for a while, but now we're starting to see the GLPs come into play. So that's your Ozempic and your Mounjaro, which are indicated for type 2 diabetes. But as you probably heard, Ozempic and Wegovy are one and the same. They're both semaglutide, and then Mounjaro and Zepbound are also within the same actual drug, and that's tirzepatide. There also is the SGLT2 inhibitors, so that basically will help with like always peeing out the glucose is what we say, and that kind of helps to bring down those blood sugar levels as well, and more of like a diuretic component, and helps with blood sugar inadvertently too. The GLPs, of course, are starting to come into one of the prime ones, but require a lot of playing around with insurance formularies usually. And so sometimes they'll prefer one over the other, and you have to meet certain criteria. But those are the ones that work to kind of slow the digestive system and help really primarily with the weight loss aspect of diabetes. So it tells your body too, sometimes gives your brain the cues that to eat smaller meals, you get like satisfied from eating a little faster, and so you're not indulging as much, and that's what those primarily help with. And then metformin just helps to also bring down the insulin levels, or bring down the blood sugar level.
Yeah, so if you're looking at this and you're going, oh boy, GLPs, this is all that I hear about right now. This is kind of newer to our first line treatment slide here. Before really it's metformin and some other options that have really fallen out of favor. As pharmacists, we honestly really do love this GLP-1 category, because what it's done is it's really in the past 10 years taken our fridges from being stocked with mostly insulin, and that being really a staple of treatment in type 2 diabetes, to now our fridge is kind of converting to GLPs. And we love that for our patients, because the GLPs come with a lot less monitoring, side effects, risks than insulin. So that shift has been really nice to see for our patients, that it's either preventing them from having to progress all the way to going on insulin, where you have to do very strict control and monitoring, or being able to take someone off of insulin and put them on a GLP-1. So as pharmacists, they really have done a lot of great things for us with diabetes.
So here's just a little intro on how to use them. Of course, if you or a loved one were to ever be placed on these, I heavily encourage you to ask questions with your provider's office, or if not, with your pharmacist, of course. But Mounjaro comes in 4 pens. Mounjaro and Zepbound come as 4 individual pens. So you can see those are the areas that stay consistent on where to apply it. So within that like inch range around the belly button, onto like the tops of the thighs and then the back of the arm. So you're looking for like a fattier area in order to inject into it, because it is a subcutaneous injection, if you've heard that term. With the Mounjaro pens, they are, like I said, individual use pens. The needle is already in there. When you go to use it, you kind of pull off that base there that they show in step 2, and then there's a lock and unlock mechanism. Once you're ready to do, you want to make sure you wash the area, rather like an alcohol prep pad or what have you, before you inject. But then you place it and then you press the button. Make sure you unlock it. But this, with Mounjaro, it has the clicking sound. So you hear one click to make sure the medication is starting to go, and then another click to let you know that it's done. Some people might not hear it, but it's good just to keep it, pressed in against your stomach or wherever you're injecting for at least about 10 seconds to make sure all that medication truly gets into the body. And then once that happens, you can toss away your applicator for them. And then with Ozempic, it is just 1 pen. The beginning starting doses can last anywhere from 6 to 8 weeks for that, using that singular pen. The big thing with this is to make sure you can see it, that it's colorless, that your pen has no faults in it when you go to use it the first time. It does come with needles, so you screw those on and you'll have to use a new needle each week when you inject it. And then if it's a new pen, you want to make sure it's primed. essentially, and this is a similar component I'll talk about with the insulin briefly, just making sure. So on the Ozempic pen, it has like 2 dashes, so like little squirts of like water that you're looking for, or in this case, the medication itself. And you attach the needle and just make sure it's ready to go. And you just have to do that the first time you start a new pen. Once that's done, you dial to your dose. So that starter pen has 2 doses in it. So you always want to do like it's a lengthy scroll. I tell people like you're scrolling on the internet. It's a lengthy scroll until you find the 0.25 or the 0.5, depending on the dose that your doctor is wanting. But then once you get to that, you apply it in the similar areas as the Mounjaro. And then this says to hold it for about 6 seconds, right? Like 6 to 8 seconds, just to make sure the medication truly goes into the area and that you're getting that full dose. When you're done, you just throw away the needle in a proper sharps container, and then you're good to go for the next injection. So getting into insulin a little bit, as I had mentioned, this one is the initial therapy for those who have type 1 diabetes, but it can be added on later on for type 2 diabetes if those other primary therapies fail or aren't doing as much as the doctor would like. It comes in pens or vials, so you have a similar pen situation to the Ozempic product, or else you have vials that you have to use your own insulin syringes to kind of draw up the units each time. So they're a little more difficult, require a little more time. And then there are 2 different types of insulin. So there's the basal, which is your long-acting one that you usually start off with by using at night. And then you have the bolus, which are usually done in relation to meals, are a little quicker onset, but you have to dose more times throughout the day.
So you can quickly see based on, both of these reviews that Liz just did, how complex insulin can be versus a GLP-1, where GLP-1s, you're given a dose by your doctor, you're doing that once weekly. It's not dependent on you pricking your finger, getting a blood sugar and reacting that way, versus insulin is typically dosed multiple times a day. You are, none of these come in auto injectors. You are pricking a finger or looking at CGM data and responding that way with dosing. You're typically given some kind of sliding scale dosing, which can get complicated, and then reacting to both high blood sugars and low blood sugars, where GLP-1s, you're not really reacting to blood sugars at all. That dosing is going to be changed by your provider on like a monthly, every 4-week basis.
So as I mentioned, the basal insulin is the long-acting one that allows for coverage throughout the day. This is usually where they will start with type 2 diabetics as an add-on, being that it's only dosed once a day, and it's supposed to kind of help with those fasting and pre-prandial meals, blood glucose levels, which are before meals. There are the common types of basal or insulin glargine, Dedamer, and Dacludec. But the biggest ones I feel like we see are between like Lantus and Basaglar are more commonly what's prescribed, what are on formularies. And then you have the bolus insulin, which, as I said, is a rapid acting, so it starts working a little bit quicker, but only lasts for so long. So that's why you dose up to 3 or 4 times a day, and usually are in relation to meals. It's obviously preferred for the mealtime coverage and helps to target those postprandial or after meal glucose levels. So when you see that little spike, it helps bring that down. And those common types are Humalog and Novolog, which you probably have all heard of at some point. So then here's just a picture of the Lantus pens. So you can see it's a very similar, it looks very similar to the Ozempic. Same thing, you apply a needle each time you go to use it. This, of course, is a daily thing opposed to a weekly, so you'd go through those needles much faster. And then it does have a similar dosing window. So the first time you go to use a pen, you might want to make sure too that it's primed and ready to go by just going up to like 1 or 2 and make sure you see that it's coming out. And then from there, you can scroll to whatever amount of units your doctor has prescribed. So sometimes with basal, they will start at 10 units, and you just scroll up to there, and then it delivers that dose. These pens are good for 28 days with Lantus, and can be left at room temperature, but you want to keep the overall product in the refrigerator because then they're good to the expiration date that's on the box. Here is also a Lantus vial. So same thing applies for this one. It's only good for 28 days once you start using it and can be left at room temperature. With this, you do have to make sure you're wiping that top area, like the stopper, every time you go to use it. And you want to make sure that you're using the correct syringes and it just is a little bit more, requires more steps. But this is the product that they commonly will put into the Omnipod, which I'll show you a picture of next, because it can be delivered through that. So here's a picture of the Omnipod. This one helps to do the insulin delivery. It's a big thing, especially with like type 1 diabetics will use this, because it kind of does that insulin delivery for you. You load it into that little metal cartridge there, and it kind of delivers the insulin as you need it. So the nice thing now, and I think it's just within the past couple of years, not even, that they've integrated, so this device can react to the levels you're getting from your CGM. So they can take data basically from the Freestyle or the Dexcom and see, hey, this person is really low right now. Like, let's not give them that dose, or hey, their blood sugar levels are really high. Let's give them like a little extra dose. Then, they might. And it can react to that a lot better than, when you're monitoring with all those pricks. So just a little bit how to use. So as I mentioned, the pen or vial for Lantus is only good for 28 days once you start using it. And then it's 56 days for Tresiba. Some of the other ones probably have a little bit different timing as well. Let me get to it. There'll be a question in a minute. Both these products can be left at room temperature, and then just making sure you're starting and priming those new pens and that you're using the same subcutaneous injection locations that were pictured on that one place for Mounjaro. Okay. So all these, as we've been talking about, have needles, have a syringe component. So there is this neat little website, safeneedledisposal.org, where you can go and you can search by zip code. I think you might have to select the state you're in, but then you can search by zip code which areas would take back sharps. So there's the local sites like Highland Hospital, Monroe County, Eco Park. I know they have certain days where they take back. There's Unity Living Center, Strong Memorial. Those are just some locations. But in general, you just want to make sure you're safe around these. So if it's not your blood and you're helping someone else with these injections, making sure you're using gloves and making sure that you're disposing of these needles in a proper way. So that can be, the common thing is a laundry detergent tub that you put in there and then take it somewhere to dispose of it in one of the sites, or a coffee can. There's a lot of options out there. So here are some signs like to look out for hyperglycemia. So the big three I'll get into in a minute, but hyperglycemia, of course, is going to be your high blood sugar, and that's when levels are, at like a larger threshold of above 180 milligrams per deciliter. There are symptoms include increased heart rate, shaking, sweating, dizziness, confusion, and then like extreme hunger. Some people will also notice that their wounds don't heal as fast as they might have, or as they did as others, because you're not having like that immune system isn't up to par. Okay, and then the big 3 P's of hyperglycemia, of those elevated blood glucose levels that they start to see, and this is what doctors will kind of screen for when they're thinking someone might be diabetic or be pre-diabetic, is polyuria, polydipsia, and polyphagia. So polyuria is just that excessive urination, like you're having to urinate constantly, whether it's in relation to drinking a lot of water or not. But then on the other hand, you have that polydipsia, which is that excessive thirst. So you're just constantly thirsty. You might experience if you have like a really big, like sugary beverage or like something, when you have a lot of sugar, you might feel like you're really thirsty, but this is more of like a constant underlying thing where you're just feel like you can't drink enough water in order to feel satisfied. And then there's polyphagia, which is just that excessive hunger. So your body thinks that it's like, in a sense, it's starving because it's not having that proper insulin secretion to break down the carbs and sugars you're eating. So then on the other hand, we have hypoglycemia. So that's the low blood sugars. And this is where basically it's caused by having too little food or too much insulin, and some medications can also cause events like this. And that's where we start monitoring too. And it can be severe if left untreated. So the symptoms of hypoglycemia: feeling faint, dizzy, blurry vision, anxious, of course, hungry because your body thinks is starving, shaky. Sometimes people might look a little pale too. So there are some ways that we can overcome that, and in the next slide we'll get into. So then you have the rule of 15 is the big one, and this is just helps to correct those hypoglycemic, those low blood sugar readings. So a normal like low one, let's say in orange there is 50 to 70, and this is where you'd want to compensate by having one serving of like a quick carb. So if it's a candy bar, if it's a sugar drink, something like that, and then you'd wait 15 minutes to test the blood sugar again and see where it's at. In extreme conditions, so when it's less than 50 milligrams per deciliters, you essentially are going to do 2 servings of what's considered a quick carb. So here are just some examples of what constitutes as that 15 grams as that quick carb. So one of the big things, like 1 cup of skim milk, a half a cup of orange juice, 4 glucose tablets, which you can buy at any of the pharmacies. They kind of look like Tums that are in like a little thing, or like chewing 6 lifesavers. There's some other sources too, and a lot of online resources. So a lot of that is like a certain amount, like 1 date or 2 tablespoons of dried fruit or a half a banana. There's also things like a roll or like 1 pancake that you can also use, like whatever you have at home. If someone's wondering this, honestly, if it's like a Snickers bar, like a little Snickers bar, it's a Snickers bar, right? Like you don't want them to be at a severe state that might lead to hospitalization.
Before we get into our takeaways and some healthy habits, I did see some questions pop into the chat. So I'm going to have Emily kind of help us out here.
It's only one question for now, and it's one of our mail order pharmacies for our plan is Wegman's home delivery, so probably Wegman's mail order. Can a diabetic member order Omnipods and Dexcom through Wegman's home delivery and have it billed to their Excellus insurance?
It's a good question. Do you know?
I know that they can ship all those. I'm not sure if it's covered under the Excellus plan, but if it's covered under Excellus, then they have a full formulary they ship.
Yeah.
Through the mail order pharmacy.
Absolutely. And if there's more questions on that too, you can give them to Jess and she can get them over to us so that we can look at them for you on the specifics of it. But we do have some of our home delivery customers that use Omnipod CGMs that get shipped out through their home delivery benefit.
Yeah, Tyler just said formulary covers them. So if formulary covers them and it's the mail order pharmacy you're using through Wegmans, they ship everything. So that would be a yes.
Okay, so just kind of to wrap up at least that section, it ultimately just boils down to what can you build that is longstanding. So building those healthy habits. So as I mentioned, just incorporating fun physical exercise. We're lucky in Rochester that we have like the canal, and we have these outdoor venues and spaces that you can just go to, like Highland Park, that you could just go for a walk if that's like, what is functional for your family and for yourself. Finding healthy snack alternatives. So something like, it doesn't have to be the driest, like tasteless thing that you can imagine, but something that is like within like portion control and within that realm that still, gives you satisfaction that you can be consistent with. And then honestly, meal planning goes a big into this. So something that you can sit down each week and, make sure you have planned out for the week. So then by the time you get done with your day at work or whatever activities you're doing, you don't just feel overrun by the day and then order McDonald's or Burger King or get pizza or something like that at home. Somewhere where you can know, like, oh, I have these like set up meals in the fridge already that you can eat instead. And then smoking cessation, as always, plays a big role into this as well.
All right. So just to kind of wrap up our key takeaways, action items, what can you do to really prevent diabetes, prevent you from getting to that pre-diabetes stage? If you have diabetes even, what are your takeaways to make sure that you're keeping your heart healthy, which is really what this ultimately comes down to, that tie between diabetes and your heart health. The very first thing we've talked so much about this is eating better, aiming for an overall healthy eating pattern that incorporates all different food groups, like your whole foods, your fruits, vegetables, lean proteins, nuts, seeds. If you're looking at this and you're like, oh gosh, I don't know what a whole grain is, I would really encourage you, go on to Wegmans.com. They have all these categories and learnings to be able to show you. And I'll get into too, we have these little key indicators on our products in the store. So if you're looking for, I'd really like to switch out my breakfast routine and incorporate a whole grain, you'll know exactly what those products are. be more active is a big takeaway from this as well. Get at least 2.5 hours of moderate physical activity per week. That is as simple as a walk. 2.5 hours is 30 minutes a day. So if you're like Emily and I, we just take a 30-minute loop on our lunch, and that gets us our activity that we need. If you're a smoker, stop smoking. That includes e-cigarettes and vaping. And we do see that this continues to be the leading cause of preventable death in the United States.
There was a question about that while you're on it.
Yeah.
One of the questions was, how does tobacco use tie into diabetes?
Yeah, that's a good question. Really, it all links back to heart health. We don't see a ton of data that goes into like how does smoking necessarily increase your blood sugar levels and put you at more of a risk of rising blood sugars. But certainly, like when we look at the overall picture of a person, we see that as sort of a risk factor and a comorbidity that often we'll see smokers also be at risk of having diabetes, but not necessarily because of a blood sugar link. It's probably more of like a lifestyle link, if that makes sense.
So there is no connection, question mark?
I could
John,
add just
you're
a
trying
little
to-
bit to it. Yeah.
Yeah.
So it's more about like what Aaron's talking about. It's vascular health. So I'm not sure if we touch on it much, but when diabetes develops and you have a more serious diabetes condition, it can affect your eyes, which are vascular systems. So it's very small capillaries, very small vessels for your blood to go through. Same with your kidney and with your feet. So you got to think that's where like your big arteries come out of your heart and they get smaller and smaller the further out they go from your heart. Well, those end places being your eyes, kidneys, and your feet. Tobacco also affects those capillaries. So it's more of the effect of the disease of diabetes. Tobacco is just going to make the progression a lot quicker and a lot more severe. So if you're a type 1 diabetic and there's not much you can do and you're taking all the insulin and doing all the work you're supposed to be doing, sometimes disease still develops. You can help that by quitting smoking. Obviously that adds to your life. And then Aaron, I'm probably not going to talk about this much, but if anybody's interested, there's something called the ASCVD score, and diabetes and tobacco are both on that risk assessment. So it really just says, how likely is it for you to have a heart event, like a cardiac event? And a big component of that is diabetes and tobacco. Marijuana use in capillary. So although we haven't necessarily tied different types of herbs, smoking different types of herbs other than tobacco, we know that the smoke itself has carcinogens in it, but also the materials that smoke puts off can harden vessels as well. But we just haven't studied it to the degree we have with tobacco. We are guessing though, with the states many of the states allowing for the use of marijuana, that hopefully the FDA will see this as something that we can study. Right now, being a Schedule 1 substance in America, we just can't study it like we can tobacco. Good question.
That's a really good question. Yeah. Another piece of this is making sure that you're getting enough sleep. I know that we've all heard this before. It's easier said than done, but that 7 to 9 hours of sleep each night is really important when it comes to your heart health. Managing your weight. Really, when you look at this and you look at the guidelines as far as diabetes goes, as well as your heart health, it's that BMI of less than 25. Don't take this too much to heart. There's a lot of different things that go into BMI. Just make sure that you're having those conversations with your doctor and taking it seriously when they tell you that there might be some work that needs to be done here. But we do definitely see perfectly healthy people that don't have much work to do, even with a BMI that is outside of that. Making sure that you're monitoring your cholesterol, especially if you have diabetes, because of all those reasons that John just talked about. When we see that LDL cholesterol or your non-healthy cholesterol start to rise, that's where we start to see heart disease. John really hit the nail on the head here with managing your blood sugar and what high levels of blood sugar can do to your heart, your kidneys, your eyes, your nerves. The best way to monitor that is just make sure that you're seeing a primary care provider, or if you have diabetes, seeing your endocrinologist and making sure that you're on track here. Having your blood sugar in range really prevents a lot of these things from progressing. And then managing your blood pressure. That goes back to, again, just regular check-ins with the doctor. If you're in one of our stores, we have these fantastic Higgy machines. They're free to use. Go sit down on them, see where you're at as far as your blood pressure goes, but really we're aiming for a less than 120 over less than 80. So the American Heart Association also does put out a nice checklist that pertains to heart health as well as kind of diabetes and what you should be doing at each milestone in your life. These are kind of in here for completeness sake. When these slides do get shared back to you, we're more than happy to share these. But just to kind of go through some of the points very quickly. Also, if you're seeing this and you're like, I'm in my 50s, I'm not in my 20s, everything is retroactive on here. So you need to make sure that if you're in your 50s and your 60s, you're still checking these boxes in your 20s. The biggest thing is make sure that you have some kind of primary care provider that they can make sure that they're monitoring all of your major health goals, which would be your blood pressure, your cholesterol, your heart rate, your blood sugar, your BMI. If that is not something, and anything that you take away from today's presentation, find that primary care provider that can monitor you regularly. Being physically active, we've talked about that, and avoiding smoking. In your 30s, it gets all the same. You're going to see these themes go throughout all of these different checklists. Making sure that you're being active, know your family history to know what you're at increased risk of, talk to your siblings, talk to your parents to know what are you more at risk of because you have a family history of it, and be honest with your doctor and keep them informed on that. Managing stress is a huge part of this when it comes to blood pressure as well. Learn those stress management techniques, whether it's therapy, medication, or just taking a walk, if that's what your stress management is. In your 40s, it's all the same kind of things, is making sure that we're eating healthy, having your levels checked consistently by your provider. Around this time is when they'll start to do those glucose tests that Liz has mentioned throughout this entire presentation. So if you're sitting here and you're 50 years old and you haven't had that blood sugar level checked, advocate for that with your provider. If you do snore, sleep apnea is a big thing also that contributes to our heart health. Don't ignore that. Bring that up with your doctor. Now we're in our 50s and it really goes to those same things. Eating healthy, know those signs of a heart attack and stroke if you don't already, and don't ignore those signs and symptoms. If you do have any of those symptoms, you'll see them kind of off to the right here. Get help immediately. If you are put on any sort of medications from your provider, make sure that you are following that treatment plan. A lot of medications that we're talking about, whether it be for diabetes or your heart health, sometimes you can't feel that it's making a difference, but know that it is. And it's very important that we're staying adherent to those medications. If you're in your 60s, learn about peripheral artery disease, and that is really just a plaque buildup that can happen in your legs, and that can cause pain as well as reduced blood flow. So if you have that kind of pain in your leg, don't ignore it, bring it up with your provider. And again, those same themes from before: exercising, eating healthy, watching your weight, and knowing those signs and symptoms of when things are serious and when you do need help. We talked a lot about how Wegmans can help. I would encourage all of you to go onto wegmans.com/nutrition. You can see our wellness keys that are really helpful for whatever you may be working on, whether that's a heart healthy diet, a low sugar or low sodium diet, getting your whole grains. There's an entire section on diabetes health as well, planning meals that are centered around people that are living with diabetes and trying to control sugar in their diet. So I would really encourage everyone to get on there and explore the resources that we have available there. And that is everything that we have. So absolutely happy to take questions if anyone has them, and if anyone is sticking around, we're more than happy to stay around for a little bit for questions. But thank you all for having us today. Very excited to be able to present on diabetes, and show you guys what's going on in our world here at Wegmans.
I just said thank you. But feel free to add some more questions into chat if anyone had anything else.
Thank you very much, Erin, team, everyone, for your time today. If you do have any questions, add them to the chat, unmute. You can also send any questions to myself. We can follow up with the Wegmans team and get those answers back to you if needed.
Absolutely.
It's a great presentation. Thank you. Thank you.
Yeah, it's a lot of thank yous so far. Right.
Okay.
I think if we aren't getting any more, we should be all set then. Thank you again. We really appreciate it.
Yeah, thank you for having us.
Thank you.
Thanks, guys.
Bye,
Bye.
guys.
Bye.